we are now recording in progress. So we have our Cody audience here at the Thomas the Apostle Center, and we also have our Zoom audience. And my name is Mary Faven. I'm the program manager for the Voices of Faith program. And tonight we have a healthcare panel. We had scheduled 3 people. Our third person, Dawn Garrison, is unable to make it because COVID happens. She has come down with COVID, she and her husband, so she's not up to being here. Meanwhile, we have Becky Ransom, to make sure I say that last name right, and Greg McCue. And I'm going to let you guys introduce yourselves even better than that.
Becky, go ahead.
Okay, I am Becky Ransom, the Executive Director at Yellowstone Behavioral Health, and we are the Community Mental Health Center here in Park County. I have been with the agency for 22 years now, and so have a kind of a broad understanding of the mental health needs, not only in Park County, but statewide, and some of the trends that we're going through, especially over the past couple of years. And also about what the faith leadership can do to kind of help us with our work and our mission. So I'm really excited to be here. Thank Warren and the folks that made it possible for me to be here tonight.
And my name is Greg McCue. I'm a family physician that's been in practice here in Cody for about 39 years. I graduated, was raised here and graduated Cody High School and University of Wyoming, and was up on a contract program for my medical education to come back to Wyoming. And I was required to come back for 3 years and never left, actually. So I have had a long experience with Medicaid and the medical system in Wyoming over the last 39 years, and how it's evolved, and how attempts to expand Medicaid have failed over the last 7 to 8 years. And undaunted, we will continue to try to get our legislators to make the right decision and expand Medicaid. Do you want me to start?
Sure, you want us to go ahead and jump right in?
Go ahead and jump right in. Meanwhile, I will watch for questions coming from our Zoom audience. And yeah, so if you'll talk more about your specific areas, and then we'll take have some time for questions. And we've got for all of that till 8 o'clock. Great.
Okay. Well, I think the most pressing issue with Medicaid expansion is still simply the social aspects of what Medicaid expansion means to about 25,000 Wyomingites. And you have to understand who these people are. They are unfortunate. They're the unfortunate group that makes too much money to be on Medicaid, straight Medicaid as an adult, and they don't make enough money to be assisted with the Affordable Care Act in obtaining private insurance. So they're sort of the betweeners. They make single person, they make about $12,800 or more, and they make less than a single person, about $18,000. So there's that small group. Well, it's not small, it's 25,000 in a small state that is not able to get assistance for their basic medical care. So who are these people? They're about 75% of them are employed. They're employed with 1 job or 2 jobs or 3 jobs, none of which provide health care. A lot of them they can be small ranchers, they can be small business owners, they can be entrepreneurs that just are getting off the base and simply don't have the money to, or they're falling in that area where they can't get medical assistance. A lot of these people have assets. So whatever they own, a house, a car, whatever, they are exactly one accident or one illness from financial disaster, because they will take your car. They won't necessarily take the house, but still the number one cause of bankruptcy in this country is medical expenses. So these people are just in a really tough spot. And how do they respond to that? How would anybody respond to that? People still get sick, whether you've got insurance or not. When you get sick, you go to the emergency room. And unfortunately, that is the most inefficient, expensive way to provide medical care. You don't go to an emergency room for preventative care. So preventative care is delayed. And you shouldn't go to an emergency room for management of your chronic medical illness. Those should be managed in their family physician's office or their primary care physician's offices. But if you can't come up with enough cash to even pay for an office visit, let alone your medications, you're not going to go to these people. And so you can put a lot of stuff off for a long, long time. But particularly with chronic illnesses like diabetes, the price for that is enormous. The price for the patient, maybe their life, the price for the rest of us is a huge medical bill. And high private health insurance. Hospitals in this state provide about $100 million in uncompensated care.
And that's just the state.
That's this state. And that money it comes out, it has to come from somewhere. Hospitals are not, nonprofit hospitals must make a profit. If there's no margin, there's no mission. So they have to come out ahead. How they do that is they charge everybody else. And they raise the price that insurance companies have to pay. And that raises everybody else's premium. Wyoming Department of Health said that, or is estimated that we can drop our private healthcare premiums by 5 to 15% by simply passing Medicaid expansion. That's what their statistics are. Could be better, could be worse. And these patients kind of get a double whammy, honestly. If they go to a hospital, hospitals have different prices for different groups. They have a price for Medicare, which is quite low. Physicians are stuck with the same thing. Price for insurance, which is whatever that insurance can strong arm the hospital or the physician into. It's usually a substantial discount. If you go to a hospital, you pay full price. If you don't have Medicare, Medicaid, private insurance, you pay full price. Now, for many people, that means nothing because they don't have any money and the hospital just goes without the money. But if you've got something, it's going away. To talk about the economic aspects of Medicaid expansion, kind of mentioned $100 million. Usual Medicaid is like 50% state and 50% federal funding. If we expand, it's 90% federal funding, 10% state. And I'm not really good with accounting, but I understand there's like a $34 million additional incentives that the feds put up for the state. So there's an extra $34 million in there. And this, we mentioned that there's like $100 million uncompensated care to the hospital. So we now compensate that. We expand Medicaid, and we're now compensating hospitals for $100 million. Well, who gets that money? Physical therapists, respiratory therapists, nurses, doctors. The whole medical health care team gets $100 million in the state of Wyoming. So what do? They spend their money and they spend it in their community. It doesn't go back to a CEO, God knows where. It goes to people that spend money in your community. And that, I'm not a good accountant, but my understanding is that multiplies over a period of time. I mean, you get each dollar you spend in your local community goes like to $4 or something like that to benefit the community, because it just goes round and round and round. We talked about private insurance, the benefits of that. Another benefit of this, and Becky, I'm sure we'll talk about that, is increasing mental health funding. The largest part of our mental health budget is through title or Medicaid. And so you get an extra $1 million in Medicaid, we can spend it for you, because we've got plenty of mental health issues in the state that need attention. I almost hesitate to talk much about counter arguments, because they're, after talking for this and dealing with this for 7 years, doggone it, there really isn't a lot of good counter arguments, honestly. I mean, if you're afraid of socialized medicine, I don't even know what socialized medicine is. Nobody else does either. It's a term that just that doesn't really add to the conversation. There's a lot of different ways to finance medical care, but the bottom line is people are going to get sick, and we have to come up with some viable system of keeping them as healthy as we possibly can. A common concern is that the feds will default on their obligations to pay for Medicaid. Well, honestly, if they do that, the state can actually pull out of the Medicaid program. But honestly, if the feds stop paying their bills, I think that's going to be the least of our problems, because they're not going to be paying for highway funds. They don't pay for payment in lieu of taxes funds. They're not going to be paying for COVID, or we accepted COVID. We accepted all of this money, except Medicaid is just we're just concerned that it might not work if we accept Medicaid money. There's concerns about overuse of the emergency room. Folks, the emergency room is where these people get their medical care right now, and it's the most inefficient place to do it. And so this is just a non-issue, plain and simply. In summary, actually, it's okay. Who thinks this is a good idea? Okay, the Wyoming Medical Society, the Wyoming Academy of Family Physicians, the American College of Physicians, Wyoming branch, American Heart Association, American and Wyoming Hospital Association is all in favor of expanding Medicaid. And come on, folks, if Medicaid was going to ruin the medical system in Wyoming, expansion of Medicaid, why are all these medical associations adamantly in favor of expanding Medicaid? It makes no sense. In short, my summary, and I think I did go over it, but in any way, it's the right thing to do. That's the short and the long version. Thanks for your time.
Do you want to see if there are questions for Greg before we move on to me, or?
Okay, and generally speaking, yeah, let's ask
Any questions for Dr. Greg? Can I call you that?
Been called worse.
Any questions?
So what's the hang up?
What is the hang up?
What is going on that?
What keeps it from
this is
passing?
happening? It seems like a no-brainer. We just were at the legislature a month ago. What is going on that this is not happening?
If you've been to the legislature, you kind of understand in years past, it has been a purely political issue. It was, even though like the Affordable Care Act was initially a Republican idea from Mitt Romney in Massachusetts, but that is lost in antiquity. So our delegations in Washington and the state have chosen to oppose anything associated with the Affordable Care Act. This is originally part of the Affordable Care Act. And to quote one of actually he's a Republican senator representative, I can't honestly remember his name, but he addressed the Wyoming Medical Society one year. And somebody asked him that exact question. He said, what is a hang up? Why are we not advancing this? And his answer was, we are good soldiers.
I got to speak to a senator, state senator, and then I was trying to make an appointment with a representative. Well, the representative wouldn't meet with me. And there was a trio of us from our church. And but she said that if a person had their church should pay for them.
There's
Which church?
all kinds of opinions.
I know, but the thing is that, and then somebody that I met, she actually wrote to the senator and said, I happen to know that you get your medical care because you were a retired service member. And so if you can get medical care from the government, why can't some of these other citizens get medical care from the government? And then, of course, she never received an answer for that. And I do find that when I write to senators or representatives, if they don't like what I'm asking, they just don't answer me. And so why do we keep electing them?
Good point. I have to say, in defense of our fine legislators, like even at the last last legislature, a lot of the votes in favor of expanding Medicaid were Republicans, honestly.
Okay.
And a lot of them were, like one fellow said, I have voted against this 7 times in a row. It's time. You know, at a snail's pace, people are coming around that maybe this is the time, and it does give us a little bit of hope. There are some folks out there that I don't know of an argument that will change their vote. And that's it. But and they're very, and I think we need to, personal, there's an opinion piece here, but I think you have to do this stuff and get leaders of the churches, leaders of in the community, where the people in the community actually are educated. I'm not going to have them necessarily think it's a good idea or a bad idea, but at least educate them. And if people, especially around Medicaid, there's just a lot of misinformation. I can tell you that most people don't see that 75% of the people that would benefit from this are employed and doing working 2 or 3 jobs. I mean, that's just not, that is not the common opinion. I think it's true. And it's too bad Dawn's not here because she saw it every day for 15 years when she was working at the Heart Mountain Volunteer Clinic. That's who she saw every day.
That these are not people like sitting around on their keisters. These are working people who are still not able to afford insurance or medical care. I have two things. Anne Marie on our Zoom audience here is suggesting that we look at the website healthywyoming.org.
Yes.
That has a lot of good information, including how to work for legislation to get passed.
And there's and I probably have phone numbers there and emails and stuff of some people that are really kind of movers and shakers, and they're working year round, not just during the legislative session. And they're the ones that have kind of, I mean, literally, I get a lot of my information from them. So I think that's a very good.
And I close to some of our groups. I have a question. What is the track record for Medicaid expansion in other states? What has been the result? Better care, more expenses, less expenses, just generally, what has been the result?
Well, I was going to get the actual number of states that have passed it. I think all but 12 or 18 states have passed Medicaid expansion, including two wildly liberal states, Idaho and Montana. And nobody's stopped.
Good standard to compare ourselves to, right?
I mean, we got a lot in common with them, and nobody has pulled out of the program. The last legislative, it wasn't the last legislative session, but the one before that, they had just a parade of Republican representatives and senators from around the country saying, this is a really good idea. The fellow from Salt Lake was striking. He's a Republican senator or representative, but he was a physician. And he spoke very eloquently saying, hey, I'm as Republican as they get, but this is something that Wyoming needs to do. There is no downside. Utah did it. Utah is really glad they did it.
Brasso's a physician.
Brasso's a physician, yeah, but there's a lot of different opinions among physicians. I'm sorry, go ahead.
Has there been studies done or comparisons of what is the cost to a state for not doing this? Through loss of productivity and, there is a cost for not providing medical care.
Yes, and I'm not sure, I'm not familiar of that specific study.
Okay.
I guess what they've looked at is it's just a lack of $100 million, somewhere between 70 and $100 million a year being infused into the economy, which is painful.
Mm-hmm.
But that's really a good question. It's a hard one because Wyoming is such a small state.
Yeah.
It's really going to be, you're going to have a small end, number of people to actually compare to.
So as far as other states that have not accepted Medicaid expansion, Anne Marie has looked this up for us. Us, of course, Wyoming, South Dakota, Kansas, Texas, Wisconsin, Tennessee, North Carolina, South Carolina, Georgia, Alabama, Mississippi, and Florida.
Wow. Sometimes I think, and correct me if I'm wrong, because I don't know what I'm talking about, but sometimes I think it's people that, like they have a lot of maybe immigrants or people who are Hispanic or something, and they don't want to provide medical care for them. I mean, that's just a feeling that I have because I can't figure out any other reason why you don't want to help these people.
I've never really got that sense,
Okay.
honestly. Because there are, people of all races I've run across are for it again.
Well, I do think that thing that they think they're lazy people, because when I talked to that senator, she says people just need to pull themselves up by their bootstraps. But
If you couldn't hear Sally, she was saying one of the senators she spoke to about this issue said people ought to be out to pull themselves up by their own bootstraps.
yeah, but you don't have any boots.
Yeah, if you don't have shoes, that's tough.
Yeah.
But the other thing is if you can't get out of bed, it's tough.
Yeah.
Yeah.
I'm also curious, why is there that gap between 12,800 and 18,000 that's not covered by the ACA?
I don't know. I never, that much, that was written into the law. I have no explanation for that.
Probably because they can be covered by Medicaid in most states. So the federal government doesn't want to pay for something they're already paying for.
Oh.
And that's actually true. I mean, honestly, when this 7 or 8 years ago, when the Affordable Care Act, I'm trying to be delicate with this, when the Affordable Care Act was additionally passed into law, honestly, I think there'd be no state stupid enough not to pass this up.
And I also heard, and maybe this is just kind of vague, that the feds will only help with the expense for a limited number of years. Is that true?
Correct. The tax stipend or the tax break that you get when you join with the National Health Insurance Plan isn't going to be around forever. So that subsidy, which is making the insurance affordable right now, who knows how long that's going to last? Because I don't know if you remember when the Affordable Care Act first came out, it was rather expensive for folks to get insurance, because we all know people who thought, national health insurance, and then found out how high their premiums were. And so, yes, so a subsidy was written into law, but it's not there forever.
Mhm.
So there will be a time when it's expensive again.
Is that why, I'm just guessing, is that why the senators and stuff don't want to approve it, because they're thinking, okay, there's gonna be a time.
Be on the hook then.
Yeah.
But are you talking about the subsidy
The
for
tax
private
subsidy.
insurance,
No, yeah, right, no, for the going on the National Health Plan.
for the Medicaid?
No,
Medicaid
no,
expansion.
just regular
ACA.
insurance,
Okay, yeah,
ACA. yes.
using the Affordable Care Act.
Right,
Yeah,
right.
but what about, you're
Right.
saying that now, if a state signs up for Medicaid expansion, the feds will cover 90% of it and the states cover 10. But that's limited as well, I would take it.
I think it is too, but I don't know how long, what that limit is. And again, I believe it was originally limited for 5-7 years or something like that. And then, they had states that didn't sign on to, so trying to get those states on, they continued that 90-10 versus the 50-50
Yeah, it
thing.
used to be 50-50.
So, yeah, that's, things can't last. It's just unfortunate we've passed that up for 7 years, even in the future, how many years? But then you can continue to take care of your 25,000 citizens. I mean, it's kind of like, to not do that is sort of a flip on the old saying, it says it's better to have never tried than have tried and failed. I mean, that's the operation, that's the way we're operating now. We just don't want to try because we might fail. Well, not very many people in this room would have got where they are. That's the way they ran their lives.
Okay. Becky Ransom.
Sure, we'll jump right in and at the end of my presentation, if more questions come up for Doc, it's fine. I wanted to start with saying how excited I am to be here with you folks tonight, because I strongly believe in the mind and the body and the spirit connection when it comes to wellness. And the role that we all can take, the medical profession, mental health profession, and the faith leadership in really bringing a sense of wellness and healing and recovery to our communities. So right off the bat, I'm really excited to be part of this discussion and including mental health into the whole overall health picture. So I'm going to cover three things this evening. First, talk a little bit about the mental health and substance abuse system that is in the state of Wyoming right now, as far as the state-funded centers and why they're important, and especially important to the lower income and those folks who don't have any type of insurance. I'll talk a little bit about some of the trends in mental health, and then more of a call to action on how you all can help us accomplish the work that we're doing. To start off, every county in the state of Wyoming has a community provider that is contracted in part by the state of Wyoming, the Behavioral Health Division, to provide services on a sliding fee scale. So the state makes it possible for us to provide our services based on a family's income. Right now, you can walk into a private provider and pay anywhere from $150 to $250 for a counseling session. Here in Yellowstone Behavioral Health, our lowest fee is $10. So folks that are on the poverty level, $13,000 a year, pay $10 for their services. That varies somewhat around the state, but it's available to all Wyoming residents. And right now we have probably well over 8,000 Wyoming citizens that are accessing our community mental health and substance abuse centers. So it's a much needed service in Wyoming, and all the counties have a center if you're interested in where you're from and reaching out to them and making a connection with them. The sliding fee scale is incredibly an important part of what we can offer because we make it affordable for families and individuals that are seeking our services. And that is something that at the state level, it could be changing as the state faces more funding issues. So Medicaid expansion is extremely important. It's nice to hear Greg talk about that this evening because that might help offset some of those issues. The services that are offered through these centers are not just counseling, but they're also case management, helping individuals link with other resources in their communities, medication management, helping with prescriptions and managing those prescriptions, group therapy, family therapy, play therapy with children under the age of 5, intensive outpatient services for substance abuse treatment, as well as multiple residential facilities, anywhere from crisis management and stabilization facilities to transitional group homes. So for example, here in Cody, we have a mental health transitional group home, and that is a facility for folks that might need a little bit of help stabilizing on their medications, or they're coming out of a psychiatric facility and not quite ready to go back into independent living. So they can come to our group home, stay a couple months, 6 months, and we help them attain life skills so they can go home.
Mental health Hospital in Evanston.
Right, so Wyoming State Hospital is the only state facility, and that's in Evanston. But there is the Wyoming Behavioral Institute in Casper, and that's a private facility. And so they're also a psychiatric hospital. We're also fortunate up here in the northern section of Wyoming that in Billings, there are places for families and individuals.
Is the Sheridan VA a psychiatric facility too?
They're in Sheridan, and I don't know if it's through the VA, but I know Sheridan has residential facilities, and there's long-term residential, and there's substance abuse treatments. Here in Cody, we have the Cedar Mountain Center, which is an inpatient facility for substance abuse treatment. So a wide array of services are available to Wyoming residents. And to get more information about the communities that you're from, I highly recommend you contact those facilities. Some are obvious, some maybe not so much. Of course, the most obvious is the impact of the health crisis with COVID that we've gone through over the past few years. The mental health impact has been really enormous. We've got higher frequency of symptoms of anxiety, and we can all understand that. I mean, who isn't anxious anymore? And depression. Families are struggling. The children are really struggling because they're seeing mom and dad and what they're going through, and the anxiety that comes back into the home, dealing with the pandemic. The prevalence of mental health disorders has gone from 1 in 5 Americans to 1 in 4. And it's not going to slow up anytime soon. I think in the history of mankind, anytime there's been a global health pandemic, the mental health component lasts years after the medical component does. Definitely we're seeing an increase in needed services, especially with the children and the teenagers. Unfortunately, we're still seeing over half of those who are impacted by a mental health issue don't seek treatment. And so that's that is still causing, I think, an issue that we can all, the medical community and the faith community, mental health community, it's giving us more work to do. We're not done. There are still barriers to treatment. Stigma, of course, especially if we have senators saying, pull yourself up by your bootstrap. When it comes to a health issue, imagine what they're saying when it comes to a mental health issue. So we are still fighting stigma even in 2022. We are still fighting lack of education and awareness on mental health issues. So individuals are struggling. How do they describe what they're feeling? How do they communicate what they're feeling? So that is still a barrier. And then the importance of self-reliance, I think we're all guilty of. I can take care of it myself. So I think that's still, especially in Wyoming, still a cultural issue. Access to care and the cost of care, of course. I think that's that has been going on. That's not a new trend, but it's still an important one to acknowledge. So not only are we seeing an increase in anxiety and depression, but we're seeing a big jump in suicidal ideation. I'm sure you already know that Wyoming ranks #1 in the country of per capita of suicide deaths, deaths by suicide.
Mostly, is that teen?
Some, yes, but it is all ages. So the concern right now is with the young people, but suicide rate in Wyoming has been the highest. I've been in this field for 22 years. Wyoming's always been 1, 2, or 3, I think, never any lower than that. In 2021, there were 189 deaths by suicide in the state. So it is still an important issue and one that all of us can work towards addressing. Opioid use disorders on the rise. I'm sure you're aware in your communities of the prevalence of the prescription misuse, but also now the appearance of fentanyl, which is now making its appearance in Wyoming and going strong. So we're right now here in Park County, we do have a medicated assisted treatment program available to those that are suffering an opioid use disorder.
You said it was medicated.
Medicaid, right. So it uses another prescription to help
Oh,
them.
Medicaid.
Not Medicaid, medication.
Oh, okay.
Yeah,
Okay.
medication, right.
Okay, so I was
Right.
thinking, oh, they can get Medicaid to help them.
Oh, yeah, well, they could.
Good.
Yeah,
They could.
If it got
Right.
passed.
So that has become a very serious concern. I know we hear about it and around the country, but I think it's also important to be aware that it's also an issue in Wyoming. Loss of connections. And this isn't just because of COVID, which played a huge role in that. But people are losing connections, not only with family, friends, but with their community. And this is where you all play a very important role. Studies have shown that when folks are connected, where they're connected with their families and their friends and their communities, their health, their mental health and their spiritual health are better. So loss of connections is an important trend, and COVID has just made it worse. Workforce. So here in Wyoming, we really struggle recruiting mental health professionals. We all live in Wyoming because we love it. But we don't live here because of the high salaries. It's very hard for us to recruit professionals to move to Wyoming. Our salaries don't compare. And more and more people are interested in leaving the cities now, so maybe that would help. But as a community mental health center, even in Park County, which we have a beautiful area that we live in, we struggle finding people who are willing to come here for work, or they're interested, but they have a spouse and their spouse needs a job. So this isn't just Cody and Park County. I think this is a statewide issue. And so workforce is becoming more and more of a trending issue for centers, but not all of the trends are bad that we're going through right now in the mental health field. One is exciting new brain-based treatment modalities. EMDR, which is eye movement desensitization and reprocessing, and brain spotting are two brain-based treatment methods that work very well with those that have undergone trauma or have a PTSD history. So these are, I don't know if I can explain it well, but it really uses locations in the brain that get stuck when somebody undergoes a trauma. That place in their brain gets stuck. And through these treatment methods, they can move past and process that trauma and handle it and move on from it. So these are relatively new to the field and have had really wonderful success stories. The integration of care between the medical and the mental health communities. This has been a new topic, I don't know, probably within the past 10, maybe less than that years, where all of a sudden people are realizing that there is a link between the mental health and physical health, and how can we work more closely together, and how can we refer if somebody comes into a medical facility right now, they're screened for depression and referred out to a mental health provider. The same when we have clients that come to us for mental health needs, we talk about when was the last time you saw your primary care doctor and help link them to that. So the integration between mental health and physical health is a wonderful new trend that I think is going to make us all stronger and better at our jobs. Telehealth. So COVID has turned us all into Zoom users. A few years back, I'm not sure I even knew what Zoom was. So not only for meetings, but also for telehealth appointments, especially if you live in a rural community and you don't have a nearby community mental health center to go to, or what if you don't have a way of transportation? What if, you know, you're married and you have one vehicle and your spouse is at work? You know, how can you go to an appointment? How can you take your child to an appointment? So telehealth is now making it a lot easier for people to get the services that they need, and we're all getting better at it. I know when we closed our building to in-person appointments, boy, the therapists learned very quickly how to set up a camera and how to log into a HIPAA compliant confidential Zoom and talk to their clients. So that is something that we've learned and that we've adapted and that we're going to continue doing. But I think not only for mental health, but I know a lot of the health appointments are done through video now. Mm-hmm. So that's been a really positive trend. So I kind of want to end on a call to action, because we need those of you in the faith community to help us accomplish what we're trying to do. Because what we're discovering is when somebody or some individuals are really struggling with their emotionals or behaviors, they're more comfortable coming to you in most cases than they are in seeking out professional help. And so that's where we can work together. And so some of the ideas that I've come up with to help knock down these barriers for them to seek treatment are promoting an acceptance for mental health issues amongst your community and your congregations, not only in the mental health issues, but also substance abuse issues. So making it more acceptable to have these conversations, and fostering a more safe and supportive environment for these types of conversations, whether it's between you and just one other individual, or in meetings, or in more group settings. Encouraging empathy and understanding, so that somebody doesn't say, pull yourself up by your bootstrap. There's no empathy in that comment. Offer opportunities for education with your congregations or your communities. Bring in professionals to come talk about mental health and substance abuse issues, so that you can provide education, so people can define and communicate what their experience a little bit better. Encourage individuals to seek help. Have resource lists for your community on where they can go to get help. Every community not only has the community mental health center, but also private providers, other medical facilities that can provide services. But encourage that help is available, and it works. I mean, I can quote studies that talk about how treatment works. And a lot of people might think, well, you know, I don't want to lay on a couch and talk to a stranger for an hour a week for 6 years. Well, you know what? It's not that way anymore. Treatment is very successful. And so by opening up your minds, hearts, and spirits to helping those that are suffering, we're looking at 1 in 4 Americans that we can help, 1 in 4. And so I think that's a big number. And you have an important role in that. And I applaud you for, having an interest, and I really challenge you to take that interest forward, learn more, encourage more in your work with your communities. So.
Okay, one question. So I understand going to see a professional. Do you think it's okay or advisable? A lot of people want to talk to their minister or their priest. Is that?
And that is a good, like I said, that's a good starting point. The faith leadership, now there is training, there's mental health training you can take, but there are certain issues that need treatment. As faith leaders, you can guide them spiritually and guide them through understanding that they might be struggling. But in some cases, professional help is recommended.
Yeah.
And
So the pastor or the lay person.
Then it becomes our job to know when to refer.
Yeah.
yes,
So then you should tell them. Well,
yes,
this would
exactly.
be a really great thing for you to talk over.
Exactly. And I think coming to you is the first step, because they're acknowledging, boy, there's something just doesn't seem right. But with some knowledge and tools that you can develop, you can help them see, boy, you could really benefit from seeking treatment. But you can still guide them. You're not sending them off on their own. You can still guide them through their treatment. So once again, it's the mind, the body, and the spirit working together.
What's the community, shoot, I just lost I was just gonna ask you what the income guidelines are for those community centers, like if Yellowstone Behavioral in Powell.
Yes, we are in Powell, Park County.
Okay, so what's an average cost for
So the lowest fee would be $10 per
Okay.
session. The highest would be $125.
okay, and what's the availability? Like what I've seemed to witness is, when someone needs help, they need help.
Right.
So 3 weeks down the line is past we're done with the crisis.
Exactly.
In for better or worse.
And that is a requirement by our state contract. So in order to receive funding from the state, we do have to provide within 7-day access. At Yellowstone Behavioral Health, we're at about 3.
Okay.
We do offer same-day appointments. What we've discovered over time is when somebody calls and we say, oh, we can see at 3 o'clock today, they're like, oh, wait, no, I have to take my kids here and I have to, how about, and, so same day is good in theory. Now, what we do find is that we can also refer to other facilities if it's something that somebody needs to be seen and we can't fit between their schedule and our schedule. Like Heritage Health in Powell is a good example, because they also offer, I think, a sliding fee scale. So we're willing to help you find the treatment if we can't accommodate your needs.
Okay, and then on the substance abuse, what do we have?
Here in Cody, it's Cedar Mountain Center.
Which is self-pay pretty much, or private,
Right.
right?
Well, they also have a contract
Oh, do you?
for outpatient.
Okay.
Mhm.
Okay, so for outpatient,
So
inpatient, no.
they probably do. You'd have to contact them.
And
'cause I'm not gonna
there's
speak for them.
waiting list, if I recall.
I'm not sure.
Okay,
My experience with them is there's generally a waiting list for like scholarship. They actually do a fair amount of low income or no charge
but there is that,
inpatient as well as
just
outpatient.
waiting for that.
Yeah, they're probably, yeah, it's, we just have difficulty getting them in like that day type thing. But actually, they've been remarkably responsive to, at least back in the day when I was referring to them.
One other question, is there a, the alcohol, what is it called, the alcohol evaluation?
Addiction Severity Index,
Yes,
ASI.
maybe the ASI.
Mhm.
So is there any, and how can we help with this if there isn't? Is there a scholarship for that? I know that a lot of those individuals, that's what, $150?
Right, for us, it's $150. We do not have the contract from the state for substance abuse treatment. So I cannot offer those services on the sliding fee.
Scale, is there any? there's
Not through us, not through
Okay.
Yellowstone Behavioral Health.
Not through you.
Yeah, I can't speak
Okay.
for other agencies, but since we're contracted only for mental health services, so when the state gives us the funding, we have to stay within what we're funded for, and we're
Okay.
funded for mental health
Okay,
services.
okay,
So Cedar Mountain Center is funded for substance abuse, but Cloud Peak Counseling and Bighorn County Counseling, so Lovell and Worland, both of those agencies have both the mental health and the substance abuse.
so there's Cloud Peak.
Cloud Peak Counseling in Worland,
In Orland.
right, and Bighorn County Counseling in Lovell.
Okay,
So, and I can't speak for them on what, because every agency has different fees.
okay. That's good.
Yeah.
Thank you very much.
And one important service that I forgot to mention, and yet it's critical, is we do offer 24/7 crisis services. So we have a therapist on call 24 hours a day, 7 days a week, to handle individuals who feel like they're in crisis, can call, are on call. And we also we provide evaluations at the emergency rooms for involuntary hospitalization, so an involuntary hold for somebody who is suicidal or homicidal. And that fills up our time, especially
Does
lately.
the law get involved with the 24/7? Is that with crisis intervention?
No, this is for if you have a mental health crisis,
Okay,
right?
I know that that's an issue for some people, that like
Right.
crisis.
Right, no, that
Okay.
this is mental health crisis, and with the new emergence of the 988 number for the suicide crisis line. The federal government has created the 988 hotline for the suicide prevention hotline that Wyoming is working on implementing.
I have a question for both of you, actually, either one. One of the things that's on everyone's mind these days is shootings. People just sort of picking up guns and shooting. And a lot of emphasis, I think, is catching people about the mental health aspect of it. At least that's what they're blaming it on. I'm just wondering what you think about that in terms of, is that preventable with your clients? Is there red flags that you see that can indicate that somebody could pick up a gun and go shoot a school up?
Short answer, yes.
Yes?
Mhm. Now, and that's only if it comes out in the course of treatment. But if somebody doesn't seek treatment,
Right.
then no.
Yeah, or, if the treatment isn't available, again, we have to have staff to be able to get people in, as you said, it's in an emergency, when there's a situation where there's a mental health crisis. I have to admit, in Cody, I think we're very fortunate because, I mean, even though that 3-day limit is what they actually get in, but I mean, they can get in very quickly within 24 hours. They're offered an appointment, and if other people involved, like parents or that sort of thing, I mean, we are probably set up better than most. My sense is we've got better services, but we need better yet.
Right.
And I know we have Title 25 as an issue nobody can answer. We've talked about that many times. That's, those of you who don't know Title 20, well, you can.
What's involuntary
Yeah.
hold. So when somebody presents or is taken to an emergency room because of either an attempt, an overdose, or some attempt to take their own life, or they're brought in by a family member or somebody who is worried that they're thinking about suicide, then we go in and evaluate them for their suicide risk and decide whether they can be released with a safety plan, and in most cases they are. If they have somebody that can help watch over them and be there if they need help. But in some cases, then they are put on an involuntary hold, which in state statute is called Title 25. And that means their rights are taken away and they are placed in a psychiatric facility until the crisis. Or they're on hold or on a wait list. And that is actually, and Warren's right, and Doc knows this well enough, that if somebody is placed on a hold, they might wait in a hospital room or even a jail cell until a bed is available. The state hospital has a very long waiting list. WBI kind of depends, that fluctuates. However, like I said, we're fortunate with the hospitals and billings for somebody who's chooses to go voluntarily. Says, I know I need help, or I know my child needs help. We will voluntarily take them to the hospital. If you are put on a Title 25 hold, it's an involuntary. So it's a big cost to the state as well.
Title 25 must stay within the state.
Yes.
So you have two places to send them.
Yeah,
Either
for
the state hospital or WBI.
And neither one wants you. Well,
Well, I will just put in a plug for Yellowstone Behavioralists that they are absolute lifesavers for the medical profession, because our emergency room physicians are faced with someone that is either actively violent or actively suicidal. And to have someone that will come in at 2 o'clock in the morning with expertise and manage a situation, we do what we have to do as hospitalists or physicians, but to have somebody with that expertise to come in and basically manage the mental health issues with that situation, which are sometimes extremely difficult, and also the legal issues, which is that, and some, like Wyoming statute actually wants that whoever was put the person on the Title 25 hold to testify in court and all these things. And honestly, hospitalists and the ER doctors are just not really great at that. And so they provide a huge service to the patient. Getting back to the need for services, especially in like not pediatric, adolescent, those situations can wind up are extremely dangerous. Number one, that's the adolescents are who's shooting up the schools, and they are very difficult to transfer. There is not a ton of expertise out there to manage very ill adolescents. You're just basically a prisoner for 45 days. I mean, this isn't like, oh, over the weekend. It can be 10 days, 30 days. I think our record is 45 or something like
Yeah.
that. And that's inexcusable. I'm sorry.
Well, and that's one of there's things that the state of Wyoming needs help with and needs to work on, and residential facilities for adolescents is high on that list.
Absolutely. And I don't know if you want to go, if this is kind of how much you want to get into the weeds, but about talking about financing, the way they finance mental health, that if someone comes back into the community and then goes back to relapses, are not reimbursed, which is not, from a medical point of view, chronic mental illness is chronic, which means people will relapse. They can get the very best of care, and they are going to have times when they relapse and they wind up back in the state hospital. And at least in my limited knowledge, there is nothing in at least the future of financing for mental health that takes that into account. They literally think it's like, take 2 aspirins and don't call me ever again.
So you're saying that somebody with chronic issues, so they go to the state hospital for the first time, go back home, then they go back, they relapse, go back to the state hospital, second time, the state hospital doesn't get paid for it?
Well,
State hospital probably would.
yeah, the state hospital. What Doc is referring to is there's a bill has been passed to reform the funding model for centers around the state. And so they're looking at changing. Right now, we're paid based on hours of service that we provide.
Okay.
Okay, so we bill the state, we meet our contract deliverables or certain things we have to do, then we get paid. The reform is going to change that. And one of the pieces of the reform, which will take place July 1, 2024, is outcomes-based payments. And one of the outcomes that they're looking at is recidivism. So whether it's somebody who, your situation, comes back to the community, we provide them services, or not, they don't come in for their appointments, but then they end up on a hold again and back at the state hospital. Is that an outcome? Is that showing that we're not providing the proper services to that client? Well, that could be held against us as the mental health center, so that when they do get released back, we provide them services, but the state no longer pays for that.
That's kind of like the
What-
Medicare thing when you get readmitted for, you have a heart attack and then you get discharged, and then if you have another event, then they're not gonna pay you.
Yeah, that doesn't happen in most of the small hospitals in Wyoming, but larger hospitals, that's the case. And there's arguments against that as well. But I think there is honestly better justification for saying, if you do a heart cath and the guy's back in a week, well, maybe you ought to throw the second one in. But that's not the way it is with mental health. This is not something where we can stick a catheter in these people, put in a stent, and then they're no longer chronically mentally ill.
What's being done, if anything, in the jails, for mental health? I mean, they're incarcerated, a lot of them have mental health issues.
And we do provide services in the jails
Okay, so.
if we're asked.
And
If we're
where?
if we're asked
Okay,
by
jailer?
the inmate. So we don't just show up and say, does anybody want counseling today?
Okay.
Not a bad idea, but no, we don't do that. If I had the staff, I would. But yes, we do go into the jail.
And what do they allow in the jail as far as, so a patient requests, I need a counselor. What happens from that point till they see?
Well,
you?
they're still on the phone through a screen or through a window talking to each
Okay.
other, right?
Okay, but is it relatively quickly, or are we helping that person? How long does it take to get to help?
Well, if they're in crisis, we're there right away.
Okay,
And that does happen. We do get calls from the jail to do Title 25 evaluations because an inmate is presenting as homicidal or suicidal. Yes,
okay, and what about just regular?
as soon as we can get somebody there.
Okay.
Yeah, and yes, and we
And
do
have
do
they,
that.
in your experience, have they been cooperative? The system, the jail system, have they been cooperative
Yes,
in getting good?
yes, yes.
Okay.
And another piece of legislation that recently passed is help so that somebody at the prison level, so not the local jail, but in prison, being released back into whatever county in Wyoming, if they have a mental health or substance abuse issue, then we actually do the intake over Zoom, hello Zoom, while they're still in prison. And so this has become a big priority for the state, for the Department of Corrections and the Department, the Behavioral Health Division, working more closely together so that before this individual is even released back into their county, they have had an intake, they have an appointment scheduled, they show up to whatever county they're from, and they can go to that community mental health or substance abuse treatment center and start services.
Smart.
So,
Is that only on the prison, at the prison level?
right,
Okay.
right now, right, that's
Right now.
through the Department of Corrections and yeah, so prison, release from prison.
Are we doing any, I shouldn't say, are we doing anything, what are we doing for that? To get off of the #1 list on this
Suicide.
suicide?
Well, you know, that is a really good question. I
That is
have
not a list
answers.
we want to
I
stay on.
have many answers. But the one that I think concerns me the most is as we're cutting funding and reducing access to who we can provide services for, we're forgetting about upstream prevention. So I would like to see services available before there's a crisis, before somebody is even thinking about suicide, and that's prevention. We do treatment. You know, it's a mental health center. Our job is treating mental health. But there is a whole world out there, a prevention world that works at helping people before they need treatment.
Are we doing
And so-
anything in
Oh,
the state about that?
There are prevention organizations. Healthy Park County is a
Okay. good
good link here in Park County, and I think there's probably one in everybody's county. And that they have the resources and the trainings but prevention funding statewide is getting cut. And then guess what happens? Needs do this. Prevention needs. Yeah, good question.
And I guess I had one more plug for Yellowstone Behavioral. They really, under your leadership, they've done more interaction with the schools. I
Exactly.
mean, there's somebody that is available to the schools.
Yes, and we're working closely with both school districts, and they have counselors embedded in the schools. But we work closely with them, especially if we end up doing an evaluation on one of their students in the emergency room. And then we with a signed release from the parents, communicate with the school, because what happens is the student is released on a safety plan and the parent says, I'll do this, the student says, I'll do this, and this. And then guess what happens? Monday through Friday, they go to school. Parent's not there, so.
What about sort of the other way around? What if the school identifies something in a student? I assume since it's a minor, it has to go directly to the parent, right?
Right, and the schools have not school counselors, but they have mental health professionals embedded in the schools, and they have a school resource officer too. So they have places to go to initiate the process to involve the parents.
And in Cody, I can say that the police officer who's there in our high school, covers actually all the schools. He's actually doing suicide counseling on
Yes.
occasion because kids are coming to him talking about that, and he's very good. They really like the guy, and he's very good about meeting their needs and working with them individually. So that's a new thing. That wasn't in the schools when I was there.
Yeah. Yeah. So I
The
think,
woman with a ruler.
and you knew her well, didn't you? But the schools are catching on, and they're bringing the services right into the building, and having mental health professionals there.
And are most parents open to that?
I would say probably.
Okay.
And I think too, having the mental health professional at the schools eliminates the parents from having to drive to a community mental health center after school
And
for an appointment.
I spend out like a denial, like it's fine.
I'm sure there's some of that too.
Just like that kid that the parent, well, mother said, just don't get caught.
I don't remember.
You don't remember that?
Mm-mm.
Yeah. Remember, now the parents are being charged too, because they knew their son was unstable and he had guns. Because they gave it to him.
Well, and the family system, and that's one thing that we focus on is in our treatment. When we have a young person that has issues, well, it's a family system issue. And so we look at it from the family system perspective, not just, the 5-year-old or the 15-year-old.
But can you as a counselor do something when you have irresponsible parents?
No, we can train them, we can work with them, we can help them. We can report them to VFS if there's reportable offenses, but no,
Okay.
I mean, yeah.
And by the way, clergy are under that obligation as well. If we see reportable offenses, we are to report them to the Department of Family Services. That's state law.
No.
Even with the confessional, if you see abuse, you have to report it.
Even when a confession isn't private.
Because confidentiality is challenged when harm to yourself or another person comes into play.
Especially with children.
Mhm.
And does that include elders now?
Uh-huh.
Yes.
Okay. I don't
It's a strange thing how we are, and I think it's good talking about mental health issues more than we used to do, because everybody hid it. Now it's out in the open, and a lot of things are happening to make it out in the open, like the shootings. And we all see people who we think, well, what's wrong with that, and it probably is. But I always like to say, we all have mental health issues. Everybody, it's not to be held against you. Question is, can you handle it, and how bad is it? And that's where you guys can, but I'm going to repeat that thing. We talked about this one other time. When you talk about funding the legislature for mental health, and the legislature is not the real helpful. It's not their issue. And I still remember, I still remember the conversation I had with Senator Case, and he's making a public announcement at a big meeting saying, and people were questioning, why isn't the legislature dealing with mental health? And his answer was, I think I heard him say this in an interview just recently elsewhere, legislators don't care, it's not their issue, they don't know anything about mental health. They do not know about mental health. So if anybody we have to educate, it's going to have to start being some of these legislators.
And I know we're working more closely. I have met personally with the Park County legislators and filled them in on the issues here in the county. The statewide WAMSAC, which is the Statewide Association for Mental Health and Substance Abuse Providers, also works with legislators. In February, we did host a luncheon in Cheyenne, and we had well over 50 legislators that attended that. I think now, I think they're starting to pay attention. There's a lot of work that still needs to be done, and yet we're still on the path of redesigning the system. But I think they're now starting to pay attention. But additional, kind of ground swelling of, hey, the needs are growing and we need affordable and accessible care is needed. Because, I mean, they're tired of hearing it from me.
Yeah, no, I would agree with that. I think the citizens was going to need to bring it up and bring it up and bring it up. I know you're familiar with the actual total funding for mental health has declined by a significant amount in the last, 5 to 7 years.
Oh, yeah. 10 years.
It just keeps going down.
And it keeps going down.
And I hear a lot of words, but the actual numbers keep going down, and the availability, again, the same revamped healthcare program is, again, you're much more familiar with this, but they're changing the availability for low cost mental health interventions. You now have to be super poor to make yourself available for mental health interventions, or it's going to be, well, you have to pay for it. Well,
Which means
they're not getting it.
it's not getting.
They're putting up a barrier while we're trying to knock them down.
Yeah.
They're still getting put up, and that's definitely a concern.
Did you say how did you phrase it? Outcome-based results. Is that for sure going into effect?
Yes, but what those outcomes are still to be determined. So we're meeting with the state on a monthly basis over the next year to kind of look at those outcomes. Social determinants of or outcomes that are common social outcomes would be, for example, housing. So one that the state brings up is if somebody comes to you for services and they're homeless, well, your payment's going to be based on whether or not you can get them housing. Well, I can't even get my staff housed.
Yeah.
Cody.
Yeah.
So there's a lot of work still that has to be done, but that is a social determinant of health, housing.
Yeah.
It's true, it is.
Oh,
I
absolutely.
mean, it is. but-
Transportation is all that stuff.
Right.
But they are providing, and they're just writing you a check to buy them a house or build an apartment.
Well, so things they need to look really closely before they decide, yes, outcome-based payments are coming. What are those outcomes?
We don't know what the criteria for that.
Right. And so we are working, the directors around the state are working with the department staff to kind of hash that out. But yeah.
Are we doing anything with local law enforcement to
Correct.
educate?
Absolutely. It's called Crisis Intervention Training, called CIT. And we do it every year.
No, I'm working with chaplains and pastors.
Okay.
She's talking about.
This is law, this is
Training directly.
training, right?
Law enforcement.
And they spend a week, 40 hours, and mental health professionals come in and train them. Other folks come in and train them so that when they do respond to a call and there's a mental health element to that, they're a little more familiar with mental illness and how it presents.
Situations, and
Right.
they have some great technique. I've taken it twice. And what they do is they will teach you how to do little techniques to diffuse a situation, understand it first of all. That's-
Right, it's, understanding.
Recognize it.
Right, recognizing, and we do that, and we have been doing that every year for many years.
And how long is that training, did you say?
It's a week.
A week's worth of training?
So we do it here in Park County, and so of course Cody and Powell, but other departments around the state have been sending their officers to.
Do you feel like do you think we're making headway? in
Oh,
that
absolutely.
department?
It's amazing.
And
Okay.
as the chaplain, I've done this, like I say, twice, and they encourage the chaplains to be part of that if you have a police chaplain. Because, that's what we're called especially to do, is diffuse things if we're available, but most of the time we're not. And the officers have to do it. So they need to learn that, and they're doing it, and they get credit for it through posts. Some of them do it, I think, just for the post. I think we know that.
The post.
It's a certification that law
Okay.
enforcement officers have to have. And you get so many credits for it. It's like continuing ed. But, you know, a lot of them are really, that I've seen are passionate about wanting to do it right.
Oh, and it's, yeah, and the connection between the therapist and the officers, it's really helped establish those relationships.
Great,
So it's an amazing training program.
good, that's very good.
Does the Cheyenne Police Department do that?
I was gonna say, is that available in other parts of the state?
I think they do it.
I do, and I know that Roy just, the Chief Eckert, the Powell Police Department just did one in Sheridan recently.
He does the training?
He's the one that's been doing the trainings here, and they've asked him to help other communities bring the training to them. I'm not sure about Cheyenne. Some might already have CIT programs, but we've been, yeah,
That's positive.
yeah, it's really, really positive.
Riverton.
Riverton needs it. Riverton needs it.
There you go.
Yeah.
Riverton.
Needs it.
Right, Allison?
Allison.
Allison's had some experience. That's what you're working on, right? Is your justice thing of a
Justice
particular, well, it was a killing, that's what it was,
Mhm.
of a native person there. And what I saw of it was that they need a lot of help. They don't even use police cameras. They don't have, Riverton has no police cameras on the cars or the officers. And so this particular case that you were involved in, you know, there's no evidence of it. Nobody was there except all the people who saw it and said he shouldn't have died, you know.
Mhm.
And there was a particular case and still a big case in Riverton. So they do need CIT apparently because, no, it's 8.
No, maybe that guy will flunk it and then he'll lose his job.
Well, it is 8 o'clock, folks, and any follow-up questions for our speakers tonight, our guests, Becky and Dr. Greg, before we let them go?
That was really good, thank you.
And I'm
Thank you.
interested in that crisis intervention training. Yeah, how can more of us get that?
Call Powell Police.
Powell Police, okay,
Yeah.
all right.
Yeah, we can
Chief of
connect
Police
you,
is
yeah.
he's huge into it. This is
Connect, yeah.
really his thing. This Roy
It's
Eckert.
also helpful to take mental health first aid and assist, which is suicide first aid.
Right.
Yeah,
Big
absolutely.
into that as well.
Yeah, I have taken both.
I do know that there is suicide prevention training available throughout our state because I know the Episcopal Church Foundation has funding that, and we have ongoing training in that area around the state in different locations. So if that's something that's you're looking for, keep your eyes peeled for that.
Are either or both of you available for group church meetings to come educate?
Sure, we're a tag team.
Aha!
Sure, absolutely.
Okay.
Yeah.
And she happens to be local, so. Will you come to Saratoga if we need you?
Oh, absolutely. Come to Saratoga.
I told you we'll do the PowerPoint, we'll go on the road.
Yeah, there we go.
Well, we'll close now. We thank our guests. Thank you. Thank you, everybody on Zoom and here. Goodbye.